Okay, Uncivilized Anatomy playlist. So we're continuing with the vertebral column. I have drawn, doodled out two interlocking typical vertebra. These aren't any vertebra in particular. You can't tell if it's lumbar or thoracic or cervical from the body shape because I haven't gotten to that yet. So two typical vertebra. Take a second to look at this because it looks like a hot mess. So this is the vertebral body. We'll call this vertebra number 5 and vertebra number 6, which would make this intervertebral disc right here depicted between the two as a T5 disc, right? IVD. Okay. So we have these two vertebrae, the two bodies stacked up. Then you have the neural elements coming out. I tried to sort of project them out. You've got the TP of 5, the right and left transverse processes off of the pedicles that are projecting out. Then the pedicles are going to come through with the lamina in the midline and form this SP or spinous process of T5. Down here we've got the pedicle of 6. You can't see the other pedicle element, would be over in this area somewhere. And you've got the TP of 6 and the spinous process of 6. And then they're going to overlap. Now, this is at the pedicle laminar junction, more or less. We've got a superiorly oriented or superior articular process, another bony process that sticks up. And on the anterior surface of that, it would have a planar or facet joint. And then you have an inferior articular process that projects below and articulates with the superior articular process of 6, which faces forward. So this area here, the red, would be the posteriorly oriented articular surface of the inferior articular process of the vertebra. And then this structure, where the superior and inferior overlap and the two facet joints face each other, this would be known as a zygapophyseal joint. You can also call that a Z joint, Z for you Canadians, I speak Canadian, or facet joint or articular, vertebral articular joint, posterior joint. Typically the Z joints are facet joints. And they overlap. They are a synovial joint. They are innervated. We'll talk about that in another video. So these blocks interconnect like this, kind of like an elaborate puzzle with a left articular pillar made up of those two facet joints, two facet bearing articular processes, and then a right. And then you get these two and the disc, intervertebral disc and bodies bearing weight toward the front, and you get a nice stable trifoil or triangular shape. So onto these vertebrae, I'm going to show you a few ligaments, and we're going to throw some costal elements on there. Costal elements being ribs. So at the base of the pedicle, where the pedicle meets the vertebral body, on the thoracic vertebra, you're going to find these little they're called demifacets. Right, they're little tiny, like half indentions, and there's a little demifacet here and a little demifacet down here along the thoracic vertebra. Now, I'm going to move. I'm not going to move this TP. I'm just going to draw around it. So you have the demifacet here would be called the inferior demifacet of 5, the superior demifacet of 5, and the superior demifacet of 6, inferior demifacet of 6, costal demifacets or vertebral demifacets, or costal facets. There's lots of different ways to refer to it. Now, how this is going to work is the costal element, the head of the rib is going to articulate with, there's a crest on the head of the rib. We'll do a whole costal video, rib video. It's going to articulate with the intervertebral disc. And then there are two facet joints on the head of the rib that will articulate with the demifacets on the vertebral body. So the rib is going to sit between the disc and the 5 and 6, and it's going to articulate. So your head of your rib will come around, looks like this. And it's got this sort of ridge between it, two vertebral facets, and those would articulate with the two demifacets on the vertebral bodies. And then the rib takes a hard turn and comes around, and where it makes this little bend between the neck and the body, there's another facet that's going to articulate with the anterior aspect of the transverse process, and it articulates there. So the transverse process, besides being just muscle attachment, at least in the thoracic region, is going to provide sort of a strut for the angle of the rib where it articulates. That kind of looks like a snake, right? Goofy-eyed snake, a little tongue sticking out. Ignore that part. So the head of the rib is going to articulate with the demifacets on the vertebra, and then that's the head of the rib, the neck, and then where you get the angle of the rib, there's another facet that will articulate with the anterior aspect of the transverse process, and that's going to form the costotransverse synovial joint. And that's a little planar joint, because every time I breathe, my rib, which is being supported here at that strut from the transverse process, is going to move a little bit. So if we looked at this from the top, we've got vertebral body, pedicles, lamina, transverse process, spinous process. Okay. Then what you would have is your rib is going to articulate with the intervertebral disc, and the superior costal facet will articulate with the inferior vertebral or corporeal facet of that costovertebral joint, and this crest will articulate with the disc, and then the inferior costal facet on the head of the rib will articulate with the superior demifacet or costal facet on the vertebral body. So it's right between them. Then the rib's going to angle, so it'll articulate. Here's the head of the rib, articulating with the demifacet. Then it angles up and around. And as it runs back, it's got this costotransverse joint that would be here as the rib runs out. So it kind of works like a strut back there. So now each time the rib moves, you've got the disc, the vertebral body above, the vertebral body below, and the costotransverse. That's 4 potential articulations that can cause you trouble per side. So that'd be 8 per vertebra. That's 8 potential costal joints. And then you've got 12 thoracic vertebra. So you're looking at 96 potential areas of trouble that just your ribs can cause. A lot of times patients come in and I'll say things like, well, you have a rib out, and that's just sort of layman speak, or the patient will say, well, I have a rib out. That's layman speak for usually these tiny little spasms or misalignments, they become uncentrated at the costotransverse joint. That's where that happens a lot. You don't see a lot of issue unless it's a herniated disc or a fracture of some sort at the head of the disc where it articulates with the bodies. Most of the ribs being out problems come from the costotransverse, and it's usually the result of these little tiny proprioceptive muscles that run here called intertransversarii. Those are intersegmentals, deep muscles. We'll get to those, and the interspinalis muscles. We'll get to those later. Maybe my intertransversarii have contracted and have tipped my 2 TPs a little closer together due to a spasm, which is going to change the angle that my ribs articulate with those TPs, and that can lead to all sorts of trouble too. So we've thrown some costal elements on there, and I want to throw some ligaments in this video too, because that's a lot of... you know what, we'll do ligaments in another video. That's good. Those are the costal elements and how they attach. Remember, you have 12 ribs per side, both men and women. You have the rib 1 is atypical, ribs 11 and 12 are atypical, but typically the other typical ribs, 1 through 7 are your true ribs. They're going to come around, articulate with the breastbone in the front, or the manubrium, or the sternum proper, via the costal cartilage on the front, which can cause its own trouble. And then ribs 8, 9, and 10, which attach to the vertebra, or the costal cartilage superior to that. Those are your false ribs. And then your floating or spare ribs are 11 and 12. Those are way down. So for each of the ribs, though, at the vertebral interaction with those elements, they're all basically the same. They have those aspects. So this was the rib video. And then next we will do The ligaments of the vertebral column.